Patient crashing, oxygen dropping. You literally have minutes. Here's the 2026 vent protocol to save them. These updates in this explainer are your absolute frontline defense against total respiratory failure. With outbreaks like hantavirus, catching rapid hypoxia early is the only way to stop collapse.
Forget routine aggressive suctioning. We're strictly using closed systems now to completely stop infection spread.
The magic number? Exactly 6 milliliters per kilogram to absolutely prevent ventilator-induced lung injury. We pair this with a strict bundle: head elevation, sedation breaks, oral care, and early mobility. Plus, modern ICUs actually deploy AI monitoring to stay one step ahead of deadly complications.
To keep airborne viruses locked down, the 2026 standard demands minimal circuit breaks, period.
Proning severe ARDS patients, prioritize pressure points and secure lines to prevent accidental extubation. But wait, the alarm blares, sudden deterioration. What's your very first move in those seconds? Run the DOPE assessment instantly. D is for displacement. Check that endotracheal tube right away. O means obstruction. Is there severe secretion buildup, or are they biting the tube? P is for pneumothorax. This sudden complication needs instant recognition and rapid bedside intervention. Finally, E for equipment failure. Running this quick mental checklist literally saves lives in seconds. At the end of the day, the machine isn't the hero. The vigilant bedside nurse is. So, are nurses getting enough advanced training for future outbreaks? Drop your thoughts down below.